Merrylin LeBlanc, an astrologer here in Santa Fe, New Mexico.
Hi, I'm Michael Bartlett here, also an astrologer here in Santa Fe, New Mexico. What's on your mind today, Merrylin?
Well, what's mostly on my mind, Michael, is the conditions of our healthcare and education. And I've been reviewing some of the information about that. I'd like to start with healthcare, and because the two are the most critical issues that we are facing today, and probably not only in this country, but in many countries around the world. Getting this pandemic under control and saving people's lives is of deep concern to all of us. And there's many ways in astrology to talk about health. I mean, there's several planets and they address issues around health in different ways. And actually, all of the planets get involved by being an aspect to planets such as Mercury, which addresses our daily health, our daily well-being, what we do to keep ourselves in good shape. And going beyond Mercury, we could also say that the planet Jupiter says a lot about our health in general when it comes to our institutions, along with, I would say, the planet Neptune, because they're both related to the area of our charts, that's impacted by the sign of Pisces, but also the house, the 12th house, no matter what kind of chart, because there's many kinds of charts that an astrologer can make. I mean, we draw up a chart for a particular time and place, but that chart may be because of a certain event. It may be because of a particular animal and what that animal's been up to. It may be a chart about a business. It may be a chart about, an individual person, or it could even be a chart about a group of people as an entity. And there are a few variations on all of those. So, so in general, charts that one might look at in regard to health are really about the conditions of health and what they have to say about maybe overall health at any given time. And I know I skipped some planets in doing that, and I did mention that when planets are meeting up with these that I mentioned, like Mercury, Jupiter, and Neptune, and let's include Chiron. It's a planetoid, but very big and possible. And many people who've been following astrology know that the planetoid Chiron plays a huge role in our overall health. And when we talk about health, we're not talking necessarily about physical health. We're talking about health in a whole configuration or in a wholesome way, meaning we're also talking about our psychological health, which I think in this country is often underrated or underlooked at, under addressed, not by all of us, but by some people to our detriment. And so given these times that we're in, with the overall health of people on the planet being threatened by a virus, we might just start with, well, how does, what represents that virus? Some people might say it's Pluto, because Pluto does bring destruction, and it has been involved in many pandemics in the past. Some people may go and look at a more personal planet, such as Mars, because of the word virus itself has this root with the masculine in a sense, men, in the generic sense of man as it used to be used, not in the sense of a particular gender. And virulent, the adjective, is sort of like something that is battling, being very strong and aggressive, and so there's that root connection that the word virus has to Mars, and Mars has an attacking energy related to it. But as far as pandemics go, based on what many researchers in astrology have done who are interested in the field of health, they've pretty much equated it with Pluto. Now, there's a German astrologer, Ebertin is his last name, who was very instrumental in the development of what was called cosmobiology or Uranian astrology, in which they don't use houses, they just use the harmonics of the planets and what we call the Aries point, the beginning of all cardinal signs. And you can do it in different harmonics, you can address it. Well, in one of his books, he really points out how Neptune plays a huge role in the spreading of disease. And part of that, just in terms of tracing that astrologically, why, is that Neptune is this planet that deals with universal issues. It has no boundaries. It's represented by the sea or by fog or by clouds. That watery energy that only takes definition when Earth contains it. And so Neptune has played a huge role. And one of the things that Ebertin pointed out that he found a lot of astrologers don't look at, and I'd say partly because a lot of us usually don't use it, is what we call the parallels of declination. You know, the Earth has its parallels and its longitude, and planets, you know, can come together. Like we've had Neptune, Chiron met Neptune back in, I believe it was 2011, and started a new cycle while it was in the sign of Aquarius back. Neptune and Chiron were both in the sign of Aquarius, the end of Aquarius at that time. And one of the things that Ebertin pointed out, not in that particular example, but he pointed out that often we just look at, you know, these conjunctions and oppositions as, and often throw in squares as the manifestation of something on the physical, because those aspects belong to what we call the fourth harmonic. And the fourth harmonic has to do with manifesting things on the physical plane. So we look at that. But also, Ebertin noticed that when planets are in a conjunction or an opposition, they might not be on the same, if they're in a conjunction, they might not be on the same declination. Of course, when we have eclipses, they are, the sun and the moon are on the same declination or within 1 degree of each other. And what he noticed is that when we have these pandemics, the planets involved, such as Neptune and Jupiter, say, where you can get this huge spread of things going out around the universe, that they're within a degree of the same declination, or in an opposition case, they're within a degree of the same, what's called a contra declination or parallel, which means one's to the north and the other's to the south, but they're kind of mirroring the conjunctions of planets or oppositions of them in a very special way, just as the sun and the moon do that with eclipses. So this is kind of all the technical stuff that that we see going on. But what it made me do when I was reading that is I went back and I looked at the declinations over the past year and what's coming up. And there were so many connections between, say, Mars and Neptune, and Jupiter and Mars and Jupiter. I mean, this just because we've had all these planets in Capricorn with Jupiter and Pluto and Mars. Mars is left there, but earlier this year, Mars was there as well, and Saturn, and so some of those times the declinations were within a degree of each other, the not at this time with contradeclinations of those planets, but it was very interesting. And so looking ahead, if there's any correlation to that, in 2021, this pandemic should start to wane. I know that, some of us, and myself included, have said, God knows when the end of this will be. And that's partially true. But of course, the scientists and the doctors, the medical people have been working on vaccines and antibodies and things to help quash the pandemic in many ways. And so this gives me a little hope about the not the rest of this year, but 2021 being kind of on the other end of the pinnacle of this attack.
Yeah, this year's like the year that wasn't, or the year that isn't. It's kind of requiring kind of a reset. I mean, when you think about those planets you're speaking of, it's this all of us are having to go inward, where a lot of us are locked in our homes because of the pandemic, and those people who are going out because they have to. Some people are, a lot of people are getting sick. Some people are provoking and wanting, protesting their rights about not having to wear a mask. It's become, quite an interesting play, and you can see all the elements of each of those planets going on. And one of the things that I see right away with it is, you've got Mars in Aries, like where it's going to be for a year. Chiron's in Aries. They're really close to one another right now. We got Jupiter and Pluto and Saturn playing around in Capricorn. These are all cardinal energies, so there's, it's the resetting. It's a new time. It's a new structuring of these things. And so it's like one of these things where I think, especially because Neptune's involved in there, with Neptune in its own sign of Pisces, we have to understand we're all in this together. And I don't know if you heard this, but someone said something like, we may be all in this together, but some people have boats and some people are just floating in the water. Have you heard that line? Very Neptunian.
I haven't, but it's a good metaphor. A very interesting visual of the possibility, because the people in boats would seem to be more protected than the people in the water.
And we're seeing that, aren't we?
Although yeah, I know. I mean, I have heard a statement, I don't know how true it is, that this particular virus is not that virulent or active in water. I don't know how, again, because it seems to be spread by the fluids that come out of our mouths when we sneeze or something. So I'm not a medical scientist of any sort, but just looking at metaphors tells me that water is not a good place to be.
Well, and in a sense,
this
interesting thing when we look at these energies too, you talk about kind of the reworking of the healthcare system. The idea, that our government came forth, our government that's Republican at this point, fairly strongly Republican, and doesn't really believe on giving things away, basically said anyone who has this disease or anyone who needs to be tested, those things are free. So there's that, that Neptunian kind of an attempt to kind of meet something that's so large. I mean, I think what's happening, you mentioned the metaphors of, the energies of Neptune as being foggy and unclear. And the truth is everyone is going through this all at the same time. And there's no one who's an expert except for those people who have gone through it and those countries who are actually kind of handling it in a different way. We here in the United States seem to be, under, again, here's another Neptunian theme, we're under this misguided idea that our politicians are somehow more intelligent or more understanding of something that belongs to medical professionals themselves.
Yeah, one other, you mentioned the healthcare system, and I did, two planets that I look at for the system in general are the planets Saturn and Neptune, because Saturn provides the structure, the organizational structure. Neptune provides the overall well-being, if that's what indeed we're seeking. It kind of addresses a little bit of the psychological states that people may be in, because people who do not consider their illness to be healable or gotten over often reinforce it by their psychological conditions and states in addressing it. Sort of the power of the mind over matter in this case. But in terms of the structure, the last time that Saturn and Neptune came together was the end of the 80s, 1989, in the sign of Capricorn. And, basically reinforcing, as I see it, the structure of healthcare that we have in this country. Saturn is now in Capricorn again, in terms of its almost 30-year cycle. It's like 27 to 30 years in its cycle around the zodiac. And it's approaching Neptune. I wrote the date down when it will meet again, but not catching my eye immediately. Probably in about 5 years, 6 years at the most. And do you have that one on your mind, Michael?
I don't,
The
but what it
date?
reminds me of is that what happened at that point, I believe, is that the healthcare used to be considered a nonprofit area in the country. And I think what happened at that time period in the late 80s was that we began to privatize. And that's when insurance companies were companies that were actually making money, and administrators are now making money. So you have this huge skewing and misalignment of what healthcare is about, which is about healing people. If you talk to anyone who's in the healthcare business, doctors and nurses, there's this constant battle between them trying to take care of their patients and administrators coming in and saying, hey, you can't spend this money, you can't do that. Meanwhile, those administrators are making more money than the doctors and the nurses. I think that's something that's really wrong at this point.
I think you're touching the biggest problem we have with our healthcare system, and it's been an ongoing problem throughout our history. And that is one of the plutocrats, the moneyed class, wanting ways to make more money. And I used to say back in the 80s even that, they've been looking around and saying, where else can we make, with their corporations already making millions and even billions, even then, some of them rare, but happening. And looking around and saying, what can we hit next? Oh, the healthcare. And now it's education, by the way. It's
Right.
sort of like, where can we make money next? And it made me also look this whole thing about, around the globe, when did countries start looking towards a socialization of their health care? And the earliest date of the beginnings, and it wasn't like completely socialized like some countries have today, was back in the 1800s. But the majority started after World War II, when Saturn and Pluto were together in Leo, and like they were together in Capricorn this year, and are still in that sign. That countries started looking more at, how can we make healthcare affordable and available to everybody, and starting to adopt certain kinds of socialized medicine or universal health care. It varied from country to country and time to time, but it was in that period that the majority of, say, Eastern or not Eastern, but European in general countries began, as well as others around the world. And so I asked myself the question, I know that there were some attempts by Congress people in that period and into the 50s and during Eisenhower's and of course Johnson too, with Kennedy Johnson, about making healthcare more accessible to everybody. But the question is one that is a fundamental root problem of this country that goes back to its foundings. And that is the desire on the part of the moneyed classes, the moneyed people, the propertied people, the enslavers in some situations. But I'm not just talking about those others who had the means, who owned property, mostly white men, wanting to preserve their ability to freely enlarge their resources and their property, et cetera. And that is an ongoing battle in this country. And it doesn't just affect healthcare, it affects education, it affects all of these different things that, have been troublesome to the well-being, and I use that word in the broadest sense,
Okay.
So the millionaires and billionaires, the moneyed classes, the powerful corporations have kept, I think, universal health care, government-run health care from the people because it's a way for them to make money. And we've seen that with the insurance industry. It's very strange. Matter of fact, I'm of an age where I have Medicare, and I initially started with straight Medicare, and it was pretty easy. I went to an Advantage plan because I wanted acupuncture to be included. And I must say that Medicare was easier than the Advantage plan in terms of paperwork, protocols, et cetera. Running any large system is going to have its bureaucracy and its paperwork. But if one studies a private industry doing something versus a public entity, such as the health industry or the educational industry, I would bet in terms of efficiency, in terms of less money. I'm not talking in terms of perfection, because perfection is something to strive for, but it isn't possible to maintain on this planet. That's not the purpose of this planet. The purpose of this planet is not for us to be perfect. I think it is for us to strive to make things whole. I won't even use the word perfect. And I think that's why we come here, is to seek wholeness. And it couldn't be a more ideal setup. But I'm saying that I think that for the most part, governments that are democratic can provide services in a more wholesome, thorough way than private industries that are seeking the bottom line, and that is a monetary profit.
Right. Yeah, I mean, when you talk about it, it's funny, as you know, when I was in high school, I was an exchange student to Denmark, and so I've had a long-standing experience of social democracy, basically, is what you would call it in a sense. This understanding of taking care of everyone puts everyone in a better place. Sure, there are always downsides. Like you said, there's not anything that's perfect, but what we are looking for is some sort of a holistic approach, some sort of an understanding. And I think it's funny that here in the West, here in the United States, we call ourselves a first world country when people don't have access to full healthcare and full education. And I think that, to be honest, should be the hallmarks of being a first world country. It means that you understand that your people are who make you strong. the strength of our country is not on this divisiveness. It's very interesting, you know, with the political scene that's going on right now, because for the first time, we're seeing the Republican Party kind of understanding that maybe using people of color, especially African Americans, as a way of scaring white people into voting for them is not working any longer. We're seeing this long-standing idea of, like, you know, this overpowering, like what you talked about, you know, these white men in power and deciding how they want to do. And we've got Congress now finally addressing some of the sexism that's happening there. All these things are coming to light, you know, all the, you know, sexual mishandling, the Weinsteins and you know, our Congress people and our senators, you know, Senator Weiner, I mean, for crying out loud, I love it when people's names always just play out what the game is that's going on. But, you know, it's time to address these things. It's time to bring these things up and say, you know, enough is enough. We're all equal here. While there might be a hierarchy, which is required in order for societies to run in a proper way, we all have an equality, and we all need to be taken care of in a way, you know, when these pandemics happen, you know, and you look in the past, the people who get sick are the ones who are providing the services. And so if you don't know how to take care of yourself, and you need people taking care of every aspect of your home, you have 5 or 6 homes and you have staff taking care of all those things, and they're getting sick, at a certain point, it makes it, you can't maintain these things anymore. And therefore you need to start either taking care of themselves, or you get sick yourself, and you have to start understanding that we are literally all in this together, boat or in the water.
Yes, and thank goodness there are some people in the world who've come to those realizations, and hopefully the United States will. I know a while ago I was saying how back at the end of the 1980s, 1989, Saturn and Neptune had come together in Capricorn, where Saturn is now, actually. And in about 6 years, I think it's 2026, Saturn and Neptune will come together again, but at the very beginning of the sign of Aries, which is like, you know, something new emerging from the collective. And this gives me hope. I mean, you know, during this pre-election year that's coming to an end, there were many of us who were thinking, oh, the possibility of socialized medicine might be near at hand, depending on who's nominated to be the candidate for presidents. Well, it doesn't look that bright, but when I look at the astrology, I'm going, okay, so what's coming, hopefully, I don't know for sure, I'm not predicting an election outcome, is a buildup, or things get so bad in the next 4 to 5 years that people will finally say, enough of this, we need something different. That's my way of looking at the state of the whole business of healthcare in this country.
And it's a perfect
Now,
segue
Michael,
into,
this.
I was going to say, it's a perfect segue into the education, because, you know, when you have like an administration that we have now, where they put, you know, someone in charge of the health who doesn't really have any kind of a health understanding, and you put DeVos in charge of education, you can see that the intention is really to remove education from a whole class of people. And to me, again, this is this odd understanding of, like, this 1% group on our planet somehow believe that they exist in a separate bubble from everyone else. And so, I mean, what's really lovely about something like a pandemic is that it's a great equalizer. It requires people to understand something's difference going on. Now, I mean, I don't know if you've been looking at what the school districts are starting to look at, what the superintendents of each school district are starting to look at, and you know, the departments of education in each of the state and the federal government is, you know, we're going to have to start looking at a whole different way of doing education, whether it's going to be online or whether it's going to be more homeschooling and in the neighborhood. You know, this is setting up a whole different shift for us to be going about how people are going to be educated. The scary part about a bunch of homeschooled kids is that can be like a whole bunch of like little separatized, non-overly socialized individuals who only have a very particular viewpoint on the world. But in other ways, it could also provide for a more rounded sense in the ways, if we can find ways to keep it rounded and that's the gift of what the internet provides.
Well, a scary thing this morning, the CDC came out with a statement saying it's best to reopen the schools and let children go back. And this is a New York Times breaking news, and indicating more, in their view, also just the CDC taking a political rather than a health view of education. When we've seen cases now where children at 9 years of age and older catching the virus and passing it on. They don't see that as much as in younger children. And please, I'm not trying to underestimate the need of young children to go through a socialization process. Schooling is very, very important for them in that regard. Michael, you had a remark to make about this.
Well, I mean, one of the key planets we're talking here that's weaving in and out is the planet Saturn. And Saturn requires us to have authority. And so what we're seeing is this interesting thing. In the past, everyone was willing to give over their authority to the federal government. Our federal government each of the parties plays with, too much government, not enough government. But the truth is they're all invested in government because that's where they're making their livelihood. So what we're realizing is we can't look to, each of our states are understanding that they can't look to the federal government for guidance and help, an authority figure to help them through this issue. And even within some states, the individual school systems are realizing that they can't even turn to their governors who are of a different political party and who have politicized this whole issue that we're going through, rather than understanding that, again, we're all in this together, Neptune, and that we have to find structures, Saturn, that help put things in place, making rules that make it safe for everyone to do things in an appropriate manner. It's very important for children to be getting their education. It's important for them to be socialized. The psychological, developmental things that occur through the interaction with others is what temper each of us. It helps us understand. I mean, even though many of us can look back on our childhood and think about, the horrible names we were called and all the other things that went on, but childhood is this act of becoming, and it's like this learning and seeing what it's like, testing who we are, finding what it's like to push up against other people or to interact with other people, and finding new ways of being, and not being locked into certain little smaller ideas. So it's going to be, this is a very, this is all morphing. Like you said, I mean, we can't really see what's going to come out of this because Neptune is so pronounced in this. But we know that somehow in the midst of the storm that is Neptune, that Saturn has to go in and say, okay, what can we do? In the midst of a storm, when a hurricane comes, you have to cover your windows. There are certain things you need to do to take care of things. These are the things we need to learn to do in relationship to what is going on now.
Right. And as we're in that final phase of Saturn and Neptune that I mentioned will end in around 2026, is a gestating period for many ideas about the way that we educate kids. Neptune not only, Neptune has that institutionalizing energy. It brings together big concepts and says, okay, this is how it becomes an institutionalization. And in some ways, the planet Pluto acts as the birthing, it's very caught up in evolution and the birthing of new ideas. And public education, institutionalized education, as we know it in this country and in many other countries, began at the end of the 1800s. In 1891, Pluto and Neptune formed a conjunction in the sign of Gemini, which is a sign very caught up with what we call elementary and high school, secondary education. It's about all those little things that we learn, and important things, but they're not like the major philosophical issues that we deal with when we're in college. They happen in those years. And what we saw in this country was the establishment of the public. I believe it was the state of New York that had the first public school system at the turn of the century. And we saw the development of the public school system. Now, Neptune and Pluto are 500-year cycle. We're still in the beginning phases. We're in a sextile. We're in, if we look at the 8-phase cycles that I use with the moon cycle, we're in the crescent phase. There's the new phase, and then there's the crescent phase. And the crescent phase includes aspects such as what we call a septile, which throughout from like 2010, or no, I'm sorry, from the beginning of this century till around 2010-11, we had Pluto and Neptune in what we call a waxing, a beginning septile. Septiles are kind of faded energies. They're very difficult. They're symbolized in the Sabian symbol by a dove over troubled waters, kind of, and sometimes the dove has an olive branch. So the destination is not out of sight, but it's not easy getting there. And in terms of our educational institutions, that's one of the things that we have been looking at. Now it's back into what we call the sextile, which is part of the crescent phase, where if the right techniques are being used, there's many options. And that's what we're facing today, is many options for education, many options, or combinations of things like, the use of the computers to do online learning, rotating kids in and out of schools and small groups, et cetera. And those are the ones that we hear mostly about in the news. There may be some even more innovative ones, because this is still an emerging time where the options are plentiful. It's just the creative minds need to have a voice that's heard, and for them to get any traction at all. So as far as this change, in terms of a new cycle, we're talking into the 23rd century. And when I was looking at the cycle of Pluto and Neptune, I'm going like, we won't be alive. Even if they found a way to keep us alive, I don't think I want to be. And so I kind of thought, well, will humans still be on the planet by that time? We don't know. This is an issue that we astrologers face. We can look into the future in terms of aspects and say, well, here's some of the possibilities. And some of them might not even have come up, especially because technology and other evolutionary things happen on the planet that we may not be aware of at this time, which can give even different options than we're thinking of. We often are thinking, and this is one of the reasons why many of us astrologers, one of many reasons why many of us astrologers don't see much value in talking about the future that strongly, because the options are plentiful, and it's sort of, I wouldn't use a phrase I can't use right now, but it's sort of mind puzzles that take you places beyond what some of the computer games do.
And especially with what we're talking here, because this is a whole new, a big reset button. I think, on a certain level, all of us understood that this would be coming at a certain point. And, when you think of Saturn and Neptune, Saturn and Pluto together, especially, I just think of like, this Saturn in the old world basically kind of took on a lot of those characteristics of Pluto, you know, when you think about it. And in the modern age, you know, even though Pluto is considered, you know, kind of the great and terrible simplification, Saturn still has this amazing ability to hold it. And when you think about it from the myth standpoint, Saturn is Pluto's father, Hades' father. But from an alchemical standpoint, Saturn represents lead, and Pluto is that radioactive element. And what excited everyone so much about radioactive elements was that it was a new way that they found that the atoms worked with one another. So it's almost like this soul atom in a sense, you know. And I think there's a series coming up by Netflix they're going to be doing about Madame Curie and, you know, what she went through. But, you know, this idea that there's this almost enlightened atom in a sense, that's what these radioactive things. And Saturn's with lead is one of those few things that actually has that ability to hold that amazingly transformative power and maybe get a little bit burned around the edges a little bit, but substantially be strengthened by it. It's almost like an annealing process.
Right. You know, a planet that we haven't mentioned a lot in this conversation, planetoid, is Chiron, which plays a role in both health and in education. Chiron was both a healer and a teacher, and in many ways, that's an archetype that I would hope that in both professions, both healing and teaching, that there will be a union of the two at some point. And I know that the Chiron Neptune cycle, I mentioned it earlier, that those two had come together in Aquarius a while back, and I believe the next time they come together, they're in a new phase with each other, but it's an irregular phase. And it's one of these dates that passes out of my mind that I've written down but don't spot it among other things that I've written here. Chiron takes 50 years, and Neptune takes about 140 years. So these are kind of like strange cycles together. And the next cycle, I have this feeling it's like in 2030s that it begins a new cycle around in there sometime, that we may see a merging of teachers and healers coming together to address more the whole person. And I'm not, it's sort of the way in which there are things that we are learning about people's cognitive abilities that, in terms of brain research and psychological research, et cetera, that can help us in this realm of what we're passing on. Because basically, aside from the socialization process, what we're doing still in schools goes back to this Gemini imagery of bits of information being put out into individuals' minds. There are processes that are exceptional. That I'm thinking of the Montessori system that began at the turn of the century as well. But I guess what I'm looking, of course, that's the Pluto element. But with Chiron, maybe there could be some introduction of other processes of educating individuals that, the proverb that comes to mind is, you can lead a horse to water, but you can't make it drink. And it's sort of like teachers ideally need to lead students to the ways in which they can acquire information. The information is in this day and age is easily accessible, but the avenues for accessing it aren't necessarily, or putting, how does one, I'm thinking of somebody like Cameron, her first name is not there for me, the Artist's Way writer, who's written many books, and addressing creativity and having people look at things in different ways than how they look at them in a traditional classroom setting, that actually supports creativity flourishing. There are individual examples out there of where systems can go, but they're not there yet, is the bottom line.
I think the process
And
is trying to find ways that our schooling system, like our health system, is this idea of one system fits all. And what's great about what's happening in science is this understanding not only that our DNA is different and therefore how to work with diseases based on our own individual DNA, but wouldn't it be nice for education to be a lot more individualized? Back in the day, we used to have, trade schools, we used to have shop, we used to have home ec, there were these ways in which you would go to classes that kind of led you to kind of what your interests, kind of like what your proclivities were, your interests. When we look at a person's astrological chart, it's kind of, you can kind of actually see kind of like the range or areas in which a person might be interested. But it's kind of like this checking things out. And I think, we've removed a lot of the arts, we've removed music, we've done all these things. The testing is now based on having people, as you say, Gemini is the dictionary, right? So it's basically having kids memorize a bunch of different random words and then throw them out in the world and have them try and find some way to connect the words in a way that makes sense, right? And
right.
that's the chaos of Gemini. And then where Sagittarius goes into higher education or into higher experiences or higher philosophies is that threading of all those little individual words and making not just simple words, but going into what's called the encyclopedia, making concepts, larger ideas, larger things that then is actually relatable. And our educational system, I don't know, like you, I was raised in California. I went to school with friends of mine who were Japanese American. They didn't cover the internment camps in school. I didn't know that many of the people that I went to school with, had to go through that sort of thing. The African American stories, that are, been whitewashed. All of the things, history is whitewashing by whoever the winner is. We need to find a way where all the stories are told, because all the stories have value. Otherwise, why are we here? Like you say, it's this holistic experience of not perfecting, but of being, this blending of body, mind, spirit, emotion, and understanding that there's that level of complexity, and having systems that will actually address it, I think is what we're actually moving into. We're not simple little beings. We continue to become more complex and more sophisticated as our understandings continue to grow and as we're interacting with one another and our minds continue to grow.
Yeah, it's interesting you mentioned the case of the Japanese and stuff. I know I was in college, I was taking a class in the racism in the mind of America at UCLA. And in that class, they said, most of you think that Hitler was the first person to commit genocide. Well, think again, it was the United States with the Native Americans, and then what we did to the Japanese during World War II. I remember visiting my father and saying this. I said, nobody mentioned in any of my schooling, early schooling, that we did this. And he goes, oh yeah, he said, World War II. He said, I was going to work in Southern California past the Santa Anita racetrack. And I saw these people lined up and there were soldiers, and I stopped and I went over and I said, what's going on? And he said, we're shipping them out. We're shipping the Japs out. But even then, those conversations didn't come up at the dinner table. It was like, it's like incredible. That now one of the beauties that we have, and this is part of the educational process, is what gets put out through the news industry. Journalism is part of our learning as well.
And social
And what
media.
we're learning, right, in social media, and what we're learning by Black Lives Matter, with the Hispanic struggles, with the Asian struggles, we're learning a lot about ourselves, and this is a good thing. But a lot of that information still hasn't made it into classrooms. And when I say classrooms, I mean, elementary and secondary education, let alone college. I mean, in some places in colleges, it is there, but this is a lengthy process. It's slow to happen. Yeah,
And so we're getting close to the
unfortunately.
end of our time,
Yes,
but thank you.
it's
This is
been
really,
good seeing you.
yeah, always a great treat chatting with you. And let me switch this over so people can see where they're, how they can contact us. Your website, I understand, is still under construction.
Oh yes, it's been. I have so many frying pans going at once that the website is on the back burner.
Understandable.
Hopefully it'll move soon.
Well, I look
But
forward to
yes,
talking with you next
there.
week. Thanks everyone for tuning in, and have a wonderful week, inspired by whatever astrological understandings that help you live your life in better, more complete ways.
Adios.